Hello, Miss Smith. How's Lucy doing today?
She's doing very well. I, on the other hand, am very nervous about the surgery.
Oh, I completely understand, Miss Smith. Surgery can be very worrisome to a lot of owners, and there are a lot of risks, but rest assured that Lucy will be monitored very closely during and after the surgery, and everything being used on and around her is sterile. We also received her pre-op blood panel results back, showing that everything is perfect and she is safe to go under anesthesia.
Oh, well, that's really good to hear.
So, Miss Smith, I'm going to ask you a few questions before you leave Lucy with us for the remainder of the day. Has she had her first 3 sets of vaccinations yet?
Yes, she has.
Is she currently on any medication?
No.
Any previous surgeries?
No, none at all.
Any pre-existing conditions?
No, she's very healthy.
Is she urinating and defecating normally? Any changes?
No, they're both normal.
Has she had any coughing, sneezing, or vomiting lately?
No.
Lastly, did you withhold food for the last 24 hours as requested?
Yes, I did. She hasn't eaten anything.
But otherwise, her appetite and drinking is normal, correct?
Yes.
All right, perfect. So you can now leave Lucy with us, and we will contact you when she has woken up from the anesthesia, and let you know when you can pick her up.
Okay, thank you.
All right, Shantelle, can you go clean and set up the surgical suite while me and Jessica examine Lucy? Also, can you tell Natalie to get the surgical instruments ready?
Yes, absolutely.
All right, so temperature is 38 degrees Celsius. Respiration, 10 breaths per minute. Pulse, 90 beats per minute. Capillary refill time, 2 seconds. Mucous membranes, moist and pink. Skin tint, 1 second.
The surgeon now palpates Lucy and examines her vulva to check for any abnormalities.
All right, everything looks normal.
The circulating nurse now preps the surgical suite for surgery by clearing off, cleaning, and disinfecting all surfaces that will be used during surgery. She will then drape a sterile towel over the table in which the patient will be lying. The instrument person now begins preparing instruments by counting them, and then packing all the instruments. She then places that pack into the autoclave for sterilization. Shantelle, can I get you to restrain Lucy for a cephalic venipuncture on the left forelimb, please?
Of course.
The circulating nurse restrains for a cephalic venipuncture while the anesthetist inserts an IV catheter into the cephalic vein, removes the needle, caps the catheter, and tapes and bandages the catheter into place. She then gives an injection of promazine as the pre-med sedative. This is then followed by an injection of butorphanol as the pre-med analgesic via IV catheter. She then gives an injection of propofol via IV catheter as the anesthetic induction. This has to be administered very slowly. The patient is now unconscious and receives drops in her eyes to keep them lubricated.
Shantelle, can I get you to hold her head back and her mouth open so I can insert the endotracheal tube?
Absolutely.
The circulating nurse holds Lucy's head with her fingers behind the canines, head tilted back and mouth open, as the anesthetist slowly inserts the endotracheal tube and ties in place over snout with gauze. Now that intubation is finished, the anesthetic machine circuit is attached. The patient is now receiving anesthetic maintenance of oxygen and isoflurane.
All right, Shantelle, she's ready for prep now.
The circulating nurse now begins to prep the patient for surgery by shaving the surgical site with clippers. Vacuum and lint brush the hair. Check her work, and then vacuum and lint brush again to be sure she got it all. She will then be cleansing and disinfecting the patient by applying a chlorhexidine scrub and start scrubbing from the surgical site, working her way outwards based on the shape of the patient. She will then apply alcohol in the same manner. As well as iodine.
The instrument person now enters the room with a pack of sterilized instruments and places it on the instrument table and opens the outer layer of the pack. The surgeon now enters the room and opens the inner layer of the instrument pack. The anesthetist takes her place by the patient and the anesthetic machine and double checks Lucy's vital signs and maintenance.
Temperature is normal. The heart rate and respiratory rate are both normal. Capillary refill time and mucous membranes are normal. Lucy's doing very well under anesthesia. We're good to go.
Perfect. Let's begin. Scalpel.
Scalpel.